Hi, my name is Abrarali Dalal and I am the Director and CEO at Sahyadri Hospitals based in Pune, Maharashtra. So I think first point is that India is nowhere backward or behind any country in the West where medical equipment, clinical outcomes, etc. is concerned. Uh, we are equal. And I think because of our pricing, positioning, we will attract and we can attract a lot of medical value tourism from outside into India. However, I think it has to be more streamlined. Number one, medical tourists coming to India should not be allowed to go to any hospital of their choice. I think hospitals should be controlled and managed by the government. What I mean is that there are many hospitals in India, and uh, the patient should be sent to the hospital which gives the best clinical outcome, and that can be a hospital which is NABH certified, number one. Number two, it can be a hospital which has certain centers of excellence, and those centers of excellence need to be very, very clearly defined and categorized by the government. So if someone is coming into India for, say, example, neurosurgery, he should know that this hospital, and that should be guided by the government website, that this hospital is the best in neurosurgery, and these are the reasons why this hospital is the best in neurosurgery, and these are the doctors available in that hospital for neurosurgery, so on and so forth for all the other specialities. Also, the pricing can be regulated by getting rid of the middle agents, and if the government website kind of publishes the names of these hospitals which they eventually choose for the various centers of excellence in medical tourism, then the patient can be channelized directly through the hospital at a price which is much more better and more value for money. Yeah, I think there has to be some special flights to many other cities besides the metros where good hospitals exist, and if there are any hospitals where a center of excellence for medical tourism is defined, there could be certain special flights organized by the government to these cities purely dedicated to medical value tourism. I think Ayushman Bharat introduced by the government is a good scheme. It is a national scheme to help patients below poverty line. In Maharashtra, that scheme translates to something called MJPJY, the Mahatma Jyotiba Phule Yojana, and there's also the central government health scheme. The cover in the MJPJY in Maharashtra is 1.5 lakhs and Ayushman is 5 lakhs. So in Maharashtra specifically, if someone is availing the MJPJY scheme, and if his bill is more than 1.5 lakhs, then the balance 3.5 lakhs are covered by Ayushman. I think it's a good scheme and well supported by the government, as long as the hospitals maintain the regulations and the parameters which are set by the government. Attrition of nurses is largely related to the payments that are made, and when you look at countries outside India, Middle Eastern and Western countries, the payments of nurses there are almost 3 or 4 times or maybe more than India. I think in India there is no progression showed to the nurse in terms of a career. I think nursing is divided into basically 3 parts. One is nurses in the wards, second is nurses in the critical care areas of the ICUs, and third is nurses in the operation theatre. And the nurse has to show a very progressive path from the ward to ICU nursing to OT nursing. And if a hospital maintains to that, along with the adequate remuneration, I think attrition can be reduced. So Sahyadri Hospital started around 20 years back as a small neurosurgery institute, and as and when that institute developed, it slowly graduated into a multi-speciality hospital. Our first hospital was at a place called Deccan Gymkhana in Pune, which started as a 160-bedded hospital, and from there on, that was a launching pad to expand the hospital into almost 600 or 700 beds in Pune, in a city called Nasik and Karad. Then we had some new investors coming in, and in 2019, after certain investor came in, we expanded the 600 beds to almost 900 beds. Currently, we partner with a Canadian equity company, and we currently run around 1000 beds. Most of the hospitals are more than 250 beds. We are a quaternary care hospital. Quaternary care largely means hospitals which are equipped to do transplants. And over the next 5 years, we look at, or we are planning to add almost 1000 beds more, and we have committed and announced an investment of almost 850 crores to reach that goal. So we are set off on a continuous journey of adding to our medical infrastructure and medical equipment. Currently, if you look at it, we have around 3 Linacs in Pune, Karad and Nasik, and we plan to add almost 4 or 5 more linear accelerators, looking at the growing incidence of oncology in the country. As I said earlier, that we are a quaternary care hospital and we do all sorts of transplants: heart, liver, lung, kidneys. Our aim is to go to all the cities of Maharashtra. We plan to go to Aurangabad, Nagpur, Kolhapur, Sholapur, and become a strong regional player. And all this expansion obviously will be driven by one, A, increase in infrastructure, but infrastructure we can actually which can get in or which will have the latest state-of-the-art medical equipment and cut the drain which goes into the cities. I think it is time that people in the tier 2 cities also have access to the best medical infrastructure that a city offers.